It's a beautiful Saturday morning, the edition of ATP Live. We hope we have always educated you and we hope you learned something new today. Always sharing. Allergies and allergic. Okay, Dr. Gbemisola, can you hear me now?
Okay, yeah, I can hear you.
All right, welcome to the show. Allergies and allergic conditions in children. I'm sure you have a lot for us, and we're looking forward to learning a lot today. We can never have enough of you. Thank you for always teaching us. All right, so we're ready to learn.
Good morning, everyone. It's a pleasure to be with you again on Ask the Pediatricians Live. And today, this topic was actually one of the questions somebody asked us to address last week, and we will always try to make sure we educate our parents on what you want to know. And so here we are. So if you also want us to discuss any particular topic, you can always drop it in comments and then we'll try and accommodate it as soon as we can. So good morning, everyone. It's a beautiful Saturday and it's wonderful to be with you on Ask the Pediatricians Live. I am Gbemisola Boyede. I'm a pediatrician and founder of Ask the Pediatricians Foundation. And this morning, like Okwe said, we'll be talking about allergies. Before we continue, can you kindly share the video, share it on your timeline, share it in your groups, on your page. Just share it so that everyone can join us to learn this morning. And if you have questions on allergies and allergic condition, kindly drop it in comments and we'll be able to take it. If you have questions on other issues not related to the topic of discussion, I will encourage you to kindly go to Ask the Pediatricians Facebook group and post your questions there. One of our moderators or professionals will address that so that we shouldn't feel like we're ignoring you, but we will always like to focus on the topic at hand. So if you have questions that is not related to the topic at hand, that is not a problem. Just go to our Facebook group and then ask the questions there and it will be addressed. But on this thread, we will prefer if you ask your questions on allergies and allergic conditions in children. And if there are questions related to adult issues, please don't drop it on our group. You can ask that on ATP Family. That is where we take adult issues. So we'll go on straight to the topic of discussion for today. So what are allergies, basically? So allergies tends to refer to the fact that sometimes our body reacts to certain things in a different way. When somebody's body is reacting, or a child's body, since I'm talking about children now, is reacting to certain items in a way that an average person does not react to that particular product or item, then we're talking that person has what we call an allergy to that particular condition. So those substances that the body is reacting to is what we call allergens, whereas those the reaction itself is what we call allergic reactions. And there are some people that have certain uh, tendencies to have reactions or allergies. So when they have
Okay.
it more recurrently, we call it allergic conditions, and there are different types of them. So that is just by way of introduction. Yeah.
All right.
All
Thank you,
right,
Dr.
thank you, Dr.
Bimi.
Gbemisola.
Please don't
Please
forget
don't
to
forget to
share
share.
so that your friends can have an opportunity to ask their questions. Thank you. All right, Dr. Bimi, what causes allergic conditions? What can we say are the root cause of allergies in children?
Okay, so basically, like I said, allergy means your body is sensitive or is reacting to certain things in a different way, and for no absolutely no reason. Some people, it's
Reasons.
just your own. Well, I say like your makeup, your body makeup, your genetic makeup, and that is why you will see that one of the things we'll talk about today is that allergies tends to run in family. So and
Oh,
yes, allergies tend to run in family. So if your mom is allergic to something or has a particular allergic
something.
condition, you are also likely to you or your own children may also have that sensitivity
Same.
or that particular allergic condition. So it is just the way such people's body are made up, their genetic makeup
Made.
for them to react to certain things for absolutely no reason. Normally our body is trained to deal with foreign things that we are exposed
Okay.
to, but there's
Yeah.
a limit to which the body does that. But sometimes when the reaction is now like going overboard and all that,
Uh,
and we talk about allergic conditions. And allergic conditions or allergic reactions can be mild, it can be moderate, it can be quite severe or life-threatening.
so,
Just
wow.
recently during this week, I was reading about a little schoolboy in the UK who died
Mhm.
because of a
Wow.
dairy allergy. One of the classmates, is somebody who is allergic to dairy, and one of them was chasing the cheese, and they just put that cheese down his clothes or threw it at him. And the guy
Wow.
went into a very severe allergic reaction.
Medical.
Despite
Wow.
all the paramedics giving adrenaline, giving all those things, the child eventually died a few
Right.
days later. I mean, this tells you how important allergies are, and it's important that we recognize when people are allergic to things or when children have allergic conditions and we do with it. Not everybody have those severe kind of things.
Allergies.
And we call that anaphylaxis kind of reaction. You know what? They're very severe,
Severe.
life-threatening kind of allergic reaction. Most people don't have those severe type. Most people have the mild type.
Mild one.
But it's just to prove the point to us that allergies could be quite severe, and there are so many things that people can react to. There are so many allergens, as we call them. Let me just talk about the common allergens. We have things like
Okay.
pollens, especially from three. You see, some people, some mothers would have noticed that when your children, when they pass through a grassy or a farmland,
Yes.
they start,
They
having
become
itches
itchy.
and yeah. So that is, most of them could be allergic to pollens, things like mold, both indoors and outdoors too. Also could be things that these are common, especially abroad. But even in Nigeria, things like dust, people react to dust mites. So you see some people when you're sweeping the floor, that dust, thing that come out. If they come into that room, they start sneezing. So some teachers, they will say the children should always sweep the classroom. And you notice that some children, when they are sweeping the class, especially in public school, then the children start to sneeze, they start to have itches, and know that they are most likely allergic to dust. And so people, allergies, animal people are allergic to animals. You see some people, they cannot come near cats or dogs or things like
True.
that. So there are some people that are allergic to certain food, and there are some people that are allergic to drugs, insects and things like that. So there are different things. In fact, there's virtually nothing that people cannot be allergic to.
Not be
So
allergic to.
yeah, so allergens can be anything. And allergens can come through various routes. So people could, if you could just be from the hair, just having the smell of that thing from the hair could cause an allergic, that is inhale. You know the way you can inhale the allergens. It could be by touch. You see some people, they put on a earring, then they start having reaction, or they put on a particular cream, they start having reaction. That is allergic through contact. You could also have allergies through what you eat, so if you drink something, or if you eat something, so you could have allergies. So some people, just the fact that this, like for example, some people that have very severe peanut allergy, for example, the fact that maybe somebody have used a particular has used granite oil or something in that particular plate, and they washed it, and the person still use that plate, the person can have allergic. Some people are that sensitive to those kind of things. So basically, there are different things that children could react to, and then there are different routes. So it is not only what you eat, it's not only what you touch, even what you smell in the hair, even just just the fact that you come near the vicinity where that thing has been used, people could come down with allergic reactions. Yeah.
Thank you, Dr. Gbemisola. That was quite insightful and somewhat scary, I must say. Okay. Please don't forget to ask your questions. Dr. Gbemisola is here live to take all of our questions.
We have
There's
some
a
questions
question here
already.
from,
Yeah.
yes, okay, thank you. Oladayo or Debbie, I want to know the signs to see that someone okay, she wants to know the sign to see to conclude that
Yeah.
someone has got an allergic reaction.
Yes, thank you. That's a very, very important question. So there are many symptoms of allergy that people could have. The common one most of us are used to is the fact that people have rashes. They start breaking out in skin rashes and things like that. Another thing is that people can start having red eyes or watering eyes and things like that. So these are various ways by which allergy could manifest. Some people could have this tightening around their throat or itching around the throat. Most times children cannot express some of these things. But the common ones is they may have watery eyes, they may have sneezes, they may have rashes, they may have what we call hives, like something like like something is breaking up on the top of their skin. So these are some of the things that you could see that will show you that this person is having allergy. Sometimes you could start seeing their body swelling up, like they could have face swelling up, they could have all those kind of things. So these are signs that you may be pointing. Sometimes people's they may have as if their throat is shaking up, as if they want to pass out and all that. And sometimes if you have like the severe allergic conditions, the children could actually you could have collapse. That's the anaphylaxis, where the person actually in such cases, if you don't treat them, they may actually die from allergies. So, but the common ones is the watering of the eyes, the skin rashes, the bills, the eyes, and things like that. Those are the common symptoms of allergic reactions. But before we continue, I want to talk about allergic conditions. So there are also conditions that tends to cause that are associated with allergies. So we have like the common one, because you see, mothers ask us a lot of the time, my baby is having this. So we have allergic conditions can affect virtually any organ of the body. So you have allergic conditions like, if you start from the eyes, we'll call this allergic conjunctivitis. So these individuals, when they're exposed to allergens, they start itching their eyes, the eyes turn red, and you see that their eyes is not always white, it has this brownish kind of change. So that is allergic conjunctivitis. Sometimes it could affect the nostrils, so allergic rhinitis. So people that talk about the fact that my children's, they're always sneezing when they wake up in the morning. They will sneeze and sneeze. It's not just that, everybody sneezes once in a while, but continuously
Yeah.
sneezing and watering of the
Sneezing.
eyes, and they have it every time. Maybe sometimes it could be seasonal. Maybe there are some particular period, maybe the wet season, rainy season, or winter in other places. They could have that. Hay fever too is one of those allergic conditions. You could also have things like, if you move down from the nose down to the chest, you have asthma. Asthma is also one of those allergic conditions. So there are many form of allergic conditions. So like,
Allergic condition.
when they have difficulty with breathing, they wheeze and all that. So there's some people also have food allergies. So anytime they eat certain food, they start having vomiting, they start having bloating, they start having cramps and all that. So you have people that are allergic to dairy, you have people that are allergic to egg, you have people that are allergic to fish, you have people that are allergic to nuts. And so in fact, there are virtually anything that people could be allergic to. So those are all people with food allergies. Then there are people that have what we call drug allergies as well. So they take particular drug. Even most people will take paracetamol and they'll be fine, but some people will take that kind of medication and it will as if they're going
And
to
they will
die.
have a reaction.
Exactly. So you have so many kind of allergens, and the way you will notice that the first time you're exposed to that particular thing, and also people have contact allergies. Some people, when they put on hearing, their hair starts to itch and it will start becoming red and it will start paining, oozing water and things like that. So some people have contact. Some people, they cannot put on plaster on their skin. When they put plaster on their skin, they start, it will be as if they have a wound or something.
I even have blisters.
Yeah, even some people have latex, rubber allergy when you put on gloves, and so there are so many different kind of allergies. But the bottom line is that in all allergic conditions, there must be something like what we call the allergens that the person is reacting to. And unfortunately, sometimes we don't even know what some people, because the key solution to the key treatment, the key answer, the key, the simple answer to all these allergies is avoidance. Avoid what you're allergic to. Stay away from it. But sometimes in some allergic conditions, it's so hard to even know what are the triggers, and for those who have allergic conditions, despite all the efforts and dealing with all the triggers, they could still have some of those things, and you wonder what is it that is triggering it all this time around. So yeah, I think we should just go ahead and answer the question. So we answered that first question already.
Yes, we have.
Yeah.
Okay, this is from Daisy Goody Best. My baby's skin is always bringing out water. What's the cause?
That question is not very clear. What do you mean by your baby's skin? Yeah. So let me just,
sweating.
Yeah. I guess maybe she means the baby is having rashes and you'll be oozing. So let's start by saying that most babies also, when newborn babies, they are a little bit sensitive to all these chemicals that we expose them to. And so that is one of the reasons we always recommend that as much as possible, you don't want to expose them to I know most mothers like all those fine smelling baby products. But what makes those products fine smelling is the chemicals that they are having. And sometimes children could be sensitive to those chemicals. So we always say go for what we call hypoallergenic products. Though there are some children that also, thank you for even asking that question. I forgot one of those allergic conditions is also eczema, which is the allergic condition that has to do with skin. I talk about the eyes, the nose, the chest, skin too. So you have some people that tend to have dry, rough skin and they're always itchy and all that. I guess that's what a baby most likely may have. Your baby may have what we call atopic dermatitis or allergic skin condition. And so for such babies, the management will require for people who have allergic conditions. In other words, you can have allergic reaction without having allergic condition. So, but some people have allergic condition that means theirs is like more continuous. Exactly. So, for those who have allergic condition that is more continuous, they need a more continuous treatment as well. So,
Wow.
Most of the treatments usually we use what we call steroids. That's one of the main treatments for
Treatments.
allergy. So and you find that most allergy condition there's always one steroid. So if you're having allergic rhinitis, you may be using inhaled steroids. If you're having asthma, for rhinitis you use the steroid sprays. For
Asthma.
asthma, you may need to use your inhalers, and most of them will have steroid. For the skin, too, sometimes the dermatologists use some hydrocortisone steroids on the skin and all that. So because that is to kind of suppress the the system, the immune system, the part of the body system that is causing all those allergic reactions. We usually tend to suppress them with steroid because it's like they are going overboard from what is really normally expected. So I would say I will encourage you to see your doctor and let them evaluate your baby further just to be sure what it is that is causing your baby's to
Reaction.
confirm whether your baby actually has atopic dermatitis, which is what I'm suspecting. And if that is the case, then they will also tell you appropriate intervention. Thank you.
All right. Okay, this is another question from Tope Akiosho. My daughter of 4 years is always having cough and catarrh anytime she takes cereal.
Yeah.
Okay.
So sounds doctor is we are suspecting, that your baby may likely be allergic to cereal, especially if you notice that cough or the runny nose always come after that cereal.
That's
So
cereal.
what
Okay.
to do is to leave it off for a while, leave the cereal for a while, then try it again and see whether the thing happen again. So if it happens again, that is how you know that that person is allergic to that condition. The same thing sometimes and that is why when you go to food products, it's always good to read the labels. So people, because some people have allergies to all those things. So if you know your child is allergic to egg, for example, they would have written it on the back of that
Yes, it
product
contains.
that there's egg here or there's nuts here and all that, so that you can avoid them, and it's very, very important. And also one of the, since we have kind of jumped gun and we have gone into management as well, that some people that have allergic conditions, they may need to have emergency life-saving treatments with them. So most overseas, they will give them what we call EpiPen. EpiPen is adrenaline. It's just like something that if this person is reacting, if is having a severe, like they can just quickly give themselves so that they don't go on to, it's just like an injection, but it's reloaded. So all you need to do is to just stab the person's thigh and it releases the adrenaline and it will kind of halt the progression of the allergic reaction, because sometimes if not, the people with allergic conditions can progress very rapidly into the severe anaphylaxis that I talked about, and that is why it's important that you know what the children are allergic to, and as much as possible you avoid them. And sometimes you must be proactive to have your allergic medication like EpiPen, you have it handy so that if you need to use it, you use it immediately. Yeah. Okay. Yeah.
Thank you,
Papa is
Dr.
asking if
Gbemisola.
my child is allergic to
Okay.
cereal. Yeah. We're suspects, so we are not sure, but we suspect. So we can't just make up our mind based on just what you said now. We need to ask
Exactly.
more questions. But like I said, if it is only each time you give that particular cereal that child
Cereal.
have that thing, then the person may have
It's
some
most
sort of.
likely. Yes. All right. Thank you, Dr. Bimi. A very favor is asking, how can an eye allergy be treated?
Okay, so like I said, the treatment for most allergies. So if it's something that is ongoing, like it's a chronic conjunctivitis. So usually people that have, let me just differentiate and say people that have allergic conditions, sometimes you are fine. It's not as if you are having so it depends on how severe your kind of allergic condition is. So sometimes you are fine
Please.
in between. So if you are that type that is fine in between, it is only when you have like a reaction, then we'll treat
Sure.
that particular episode and that will be all. But sometimes some people have it like a chronic thing, like let's give example of asthma. So there are people that have asthmatic attack maybe once in a year or once in a blue moon. maybe when they're exposed to a particular thing, but otherwise in between they are fine. But there are people that almost every day they're having symptoms. So people that have attack once in a while that is intermittent, we usually they will not be on any continuous treatment. But but they must be ready that when any attack happens, then they
Comes very
take
correct.
treatment, and that is that. So people like that may have the inhaler, just the Ventolin inhaler, but they will be using the steroid inhaler like every day. But people that have a chronic kind of condition, those ones they like asthma that they have symptoms almost every day, every week. Those ones need to use a kind of preventive treatment, long-term treatment that they must take every day. So usually, which is steroids. The same thing for the eyes. So for the eyes, if it is just once in a while you have that eye redness and all that, maybe when you're exposed to something, then just using some topical eye drops to clear it will be fine. But if you're the type that means you're having it, your eyes always having chronic, yeah. So the ophthalmologists, usually they are the one that will treat that. They may need to give you the steroid anti eye drops for a while, So what I would encourage favor is that you should see your um ophthalmologist, and then they will give you the appropriate treatment, and then they will monitor, because sometimes people have allergic condition as a child, and after a while they stop having it. We people always say outgrow. We try not to use it.
Okay.
Okay, for the purposes I'm talking in a parents program, we can say they outgrow, so they don't need treatment anymore. So it's possible. So that's why it's important that the specialists or the professionals treat your child. Yeah.
Okay. A parent favor is asking again, can eye allergy lead to serious eye problems?
Not really, apart from the fact that it can make your eyes brown, and then you tend to, because when you have the itching from the allergy, then you introduce in the process of when the children are itching their eyes with dirty hands, you are introducing other things, bacteria, so you tend to have other infection as a secondary, and that is actually common to almost all allergies, even the skin one. People that have allergies, in the process of itching and all that, then they have wounds, and then it can become secondarily infected with bacterial infections and all that. So that tends to happen a lot with allergy, but on its own, the allergy on its own should not give you any eye problem per se, apart from the fact that people always wonder, why is your eyes always not looking bright?
Brown. Been smoking something.
Yeah, so that's that.
All right. Okay. Top player Akiyoshi is saying, thank you, Dr. Gbemi. We appreciate you. Please share this video so that your friends can have an opportunity to ask their questions. Dr. Gbemi is still live, and we're still talking about allergies and allergic conditions. All right. Ebere is saying, yes, doctor, it is a chronic one. Then I think you should go to the hospital, right, Dr. Gbemi?
Yes. And should see the ophthalmologist so that they can handle it. Just to say that for those who are watching on the live part, on the watch party, if you have questions, you will have to move down to our video itself and drop your question there. But our ACP moderators, if you're watching, kindly help us pull the questions from the watch party down to the page so that we can feature it and answer it. Thank you so much for watching. We appreciate you.
I appreciate you. Thank you. Okay, Dr. Gbemi, quick one. I had a child, a 3-year-old, who was always itchy. She practically had scales, and I was scared. So when she went to the hospital, they said she's heat intolerant. Can we say that's an allergic reaction?
What do they mean by heat intolerant? Because sometimes I always want to be very sure what the doctors are saying, and sometimes
they said because her skin is very dry, so she cannot tolerate heat at all. So it makes her really itchy.
Yeah, but I think that the underlying condition is still the allergic. Why is she having a dry skin in the first place? So that looks more. We tend to have that in people with allergies as well. Their skin is always dry. Though there are many skin conditions anyway, and some people have that. But one of the commonest reasons why children have dry skin, scaly skin, because it's a sign of what we call chronic inflammation of the skin, which you tend to also get in people with allergic skin conditions, allergic dermatitis or atopic dermatitis, as we call it. So it could be. So, and of course, they always need to have moisture. So their body, the skin in such people cannot retain moisture. And so, and it's difficult for you to process cooling and all that. That's why they need to cool off most of the time. So when you, like for example, one of the things we always say that when you have such children, when you are taking the bath, you don't dry them off completely. You will just damp the skin. You don't use a towel and dry them off. You see some of them when you do that, you just damp it. The dermatologist will say you just damp so that there's a little bit of water still on the skin, and then intermittently you need to go and apply. So most of us will apply our cream once a day, and you are fine for the rest of the day. For them, they may need to intermittently go and apply those non-allergic cream, moisturizing cream, and at the same time they need to keep their nails short so that they don't tend to scratch. They tend to scratch, and like remember what we said, if they scratch, they introduce little wounds which become a venue for infections to come in and all that. So but while we're still on that, can I quickly say that allergic condition tends to also occur in clusters? So apart from the fact that it tends to run in family, so if you are allergic to something, it is likely your child will be allergic to it. And so that's why sometimes we ask questions. We ask you, and even for doctors, even about drugs, we always ask you, have you reacted to any particular drug? If your child has ever reacted to a particular drug, you must always tell the doctor. So some children are allergic to ampiclox, for example, the penicillin drugs, and you must always let the doctor know so that the doctor don't prescribe another penicillin drug. Allergic to the sulfur-containing drugs like Fancida, for example. So if you have taken a sulfur-containing drug like Fancida and you reacted, then it's important to tell your doctor so that they don't prescribe it again, and they don't even prescribe other family of sulfur-containing drugs like Septrin, something like that. So it's very, very important. In fact, in some places, if you have a very serious allergy, you carry a badge in your hand to tell people that you are allergic to
this. Is like
you carry it in your hand so that we call it medical bracelets or medical alerts bracelets, so that people will know when they are giving, in case you pass out for any reason and you can't talk, then people know that, this person should never be given this kind of drug. Now, what I want to say is that for children, allergies tend to occur in clusters. So the same child may have allergic skin condition, the same child may have allergic rhinitis, the same child may have asthma. So we call it atopy match. Or initially it could start with the eyes, then went to the nose, and then go to the asthma part, affect the skin. So you tend to see that people with allergic conditions tend to have so many of them together. And most of the time, there's always a family history. There's always a family over somebody who has either one of those allergic conditions or has multiple. So if and especially the mother, or the issue from the mother's side is more likely, mothers likely pass it on to the children. So if you as a mother, you're prone to allergies, or you've had allergic conditions, then it's likely you will your children like have allergies. So you need to be extra careful. All right. Okay. So let's move on to our questions.
Okay. Dr. Akioshu here again. I have noticed that cough and catarrh are developing after taking cereal for close to 2 years now. Is there a need for her to be on medication?
Okay, so talk about the simplest solution to allergic conditions. Avoid whatever it is your child. So if you, why do you keep giving the same cereal for 2 years? This is just stay off the cereal. I don't want to believe that it's all the cereals the child is allergic to. Although there are some kind of cereal, like some people have what we call gluten allergy. So, and gluten could be in different cereal like wheat and things like that. So you may want to avoid that. So the solution actually is to know what specifically the child is allergic to. And there are people that we call allergists. Allergists are doctors with specialty in allergies and other
allergies.
Yeah, allergies. So I've used so many terminologies today: allergens, allergies.
A lot.
but basically, if you're sometimes if you're not sure what it is, because sometimes you're using something, it is not the whole food the child is allergic to, it's a particular component of it. So they have a way of running allergy battery tests, but they usually do it only for very severe cases and when the child is having recurrent allergic reactions and very severe ones or life-threatening, and they couldn't figure it out. So they can run those allergy battery tests. And of course, unfortunately, it varies from one country to another. So the one they use in US will not work for you in Nigeria and things like that. So so sometimes doing those allergy tests, they could know what it is specifically your child is allergic to, so that they can stay off. Stay off. So because that's the simplest solution. The simplest solution is to stay off. So if your child is reacting to a particular syringe, I mean, that's the simplest thing to do. Stay off it. Take other things. If your child is allergic to egg, don't give them egg. If they're allergic to fish, don't give them fish. And that's why when you go to the stores, you will see that they say don't take nuts in the stores. Don't test them, because you don't know if you are
allergic to it or someone around.
That is one of the reasons we tell mothers when you're introducing new food. Sorry, we are digressing to nutrition, but it's very important because that is where most mothers pick up allergies. They find it easier to pick up allergies from cream, soap, and things like that. But allergies from food, that's why one of the reasons we say when you're introducing new food, do it one at a time. Because you want to know what it is. If your child is reacting, you know. So if you do one cereal at a time and you don't do like I don't want to mention it, but those kind of cereal that you have added like 10 cereals together and blend it for you, you will never know which one your child reacts to. They will have added cereal, they will have added the granules, they will have added everything. So how do you know which one? So take one food at a time. And if for any reason you give your child a particular food and you think the child reacted to you are not sure whether it's a coincidence or something, you do it the second time, it happens again. That's enough for you to know that most likely the child is allergic to this food. If you really want to prove it, then you can go see the allergist to test. There's a way they do what we call patch tests and things like that. But the simplest solution is just stay off, and then your child will be fine. Okay. All right. So I don't think your child needs medication. Your child should stay off the food first. If after staying off the food, the child is still having those cancer and all that, it may just be allergic rhinitis on its own, not necessarily tied to a particular food. And in that case, then you really need to see a doctor, and that's when we may need to give medication.
Okay. This is a message from Omotola Temidayoladipo. My baby vomits anytime she takes anything produced with cow milk. Does it mean she's allergic to cow milk? Yeah, you have answered the question, I think.
Possibly allergic to cow's milk. So stay off cow's milk. There's actually what we call cow milk allergy. And especially, and remember the babies when they are born. That's one of the reasons we say you should take breast milk. I know I always talk about breastfeeding every time. Because one of the things breastfeeding does is that breast milk actually protects your baby. Because your baby is being exposed to your own
production.
Things in your own body. They are not likely to react to that compared to something from another complete agent like a cow, if you take milk from a cow. So whereas if it's a milk from a woman, the mother is likely going to be well tolerated. And then there are other anti-allergy kind of protective factors in breast milk. And so that's one of the reasons it is not even good to introduce babies early to all those formula and all those cow milk, because the babies tend to develop allergies earlier. Whereas if they take breast milk, they are more protected, So Omotola, it's possible your baby is allergic to cow milk. There's actually what we call cow milk allergy, and you should stay off. That's what it means.
Okay. Ebere is back again. Okay, please, doc, which doctor can handle an eye allergy?
The doctor that handle eyes, that's the ophthalmologist. They are the one.
Okay. All right. Sonia is saying, good morning, Dr. Gbemi. Sonia, if you have your questions, please ask your questions. And don't forget to share. Daisy, a DRA. My little niece develops rash after taking Nutribon, but it's one of her best.
Best what? Best food? See, I think I'm not so sure, but if I remember, I think it's one of those cereal I was talking about that have so many components in it already.
Okay.
If it's this, you can correct me whether I'm wrong. If Nutribon is one of those that is a mismatch of so many things.
Rice, wheat, corn.
Exactly. That's the problem with those kind of food products. You don't know what your child is reacting to in that particular. It may just be the nuts. It may just be the granule part. It may just be the wheat part. So what they need, that is why it's better not to start your children on those kind of cereal. Start with one. If you're doing maize and pap, do it alone first. Then if you want to add, then the following day, you at least after 2-3 days, you know that you are done with that one has been set.
Fine.
You can now add something else so that if there's a reaction, you know it's a new addition. Not that you can't
one
add
that you just added.
But when you are introducing them, take them one. Introduce each of the components one after the other so that you know which one the child is reacting to. Please, when you're asking questions, make it short and brief, because if you ask your question is too long, you won't see our screen. That's life math.
Wow. Life math. My son is allergic to cow milk. Okay. If he takes anything containing milk, he starts reacting. Starts with a cough, watery eyes, sneezing, catarrh, and then itching all over, and then he can't breathe. We will have to give him his Ventolin syrup and Piriton. What can we give him to supplement to cow milk? I worry because milk is missing in his diet. Okay.
There are other kind of milk, life mass. So cow milk is not the only kind of milk. So soy milk, we have what we call non-dairy milk. Go to the stores, you always say, they will say this is a non-dairy milk. In other words, this is a milk that is not from cow. That this is a milk that is from plant products like soy milk and things like that. Those may be alternative. Your child is actually having what look like a more severe kind of an allergy. You know, your child is starting not to breathe. That's not what you said. That is almost going to have a reaction. So please don't even use it and people should remember that the fact that if you're allergic to milk, for example, it's not only milk you should not take. You should not take anything that they use milk in the production as well. So no cake, no pancakes and things like that. Because sometimes people don't remember. And whenever you go to the store and you even buying biscuits and things like that, always read them, because they will tell you in the label, it is compulsory for all manufacturers of food products to always list label and to always tell you whether they even use some of those products in the same factory. If, for example, it may not, like for example, granola, for example, it may not be part of that particular food item, but if they also use granules or peanuts in that same factory for other things, they must declare that. Because some people are so allergic to things that just ordinary smell. Some people can just come into your house, people that have this peanuts allergy, just the fact that you have cooked with peanut, they've not tasted it, they've not touched it, they can start reacting. So that is why it's important. And so, life matters. I worry about your baby. So I think you should, if it's abroad, you actually have what we call EpiPen. You should have it handy. But go for non-dairy milk. There are many alternatives. So let's go for that.
Okay, talk I can't show again. Thank you, Dr. Gbemi. She doesn't take cereal again. She reacts to all the cereal I know.
So good that there are other alternative sources of carbohydrates. Anyway, cereal doesn't have carbohydrates. So there are tubers, there's yam, there's potato. Those are not cereals. There's rice. So you have so many other options to give your child carbohydrates. So cereal is fine. Most likely, I'm suspecting that most likely your baby may have more of the gluten allergy, because gluten is one of the things that you tend to see in many cereals. So it's not just cereals. If he's reacting to almost all the cereals, so it's not just about the cereal itself, it's about a particular component. I'm strongly suspecting gluten, but it's not so common in maize, but I don't know. Unless there are other things. Sometimes you think it's all the cereal, just the something. It may not even be the cereal, maybe it's something you're adding when you're preparing your cereal. People react to water. People could be allergic to warm water. People can be allergic to cold water. People could be allergic to, I'm telling you, even temperature changes. It could be the milk you are adding to it that the children is reacting, because most mothers will give cereal with the milk. So the only way you will know it's not the milk is when you give the cereal without the milk. So you really need to that's why sometimes it's hard. It takes the allergists to figure out which one it is. And sometimes even the allergists have no clue. We just don't know what the child is reacting to. Yeah, Almatala, thank you as well.
Okay. This is from Sonia. My baby has a fragile skin. Whenever I take notes, I notice she whitish substance on it. Could it be she's allergic to nuts? She's on exclusive breastfeeding.
Yeah, no, thank you, Sonia. And Sonia has even brought a particular importance which we have not mentioned. In fact, that for mothers, if your baby is allergic to something and you take it, because it's going to pass through the breast milk to your baby could actually react to it. So it's important that if you notice that you stop taking that particular food, you know what, notice that she's not giving it to the baby directly, but she's the one taking it. But because you are still breastfeeding, your baby could react to what, and that's why when you're breastfeeding, mothers always ask me, what food should I eat? What food should I not eat? You can eat any food as long as each time you eat it, you notice that your baby does it. It's not becoming fussy or having reactions and things like that. So Sonia, looking like you say your baby has a fragile skin, which I am taking as your mom speak for having allergic skin or atopic dermatitis one. And so such a baby most likely may be allergic to nuts as well. And since you've noticed that you start having rashes, whether I don't know whether the rashes is coincidence or not, because your baby already has a fragile skin anyway. But if you, and mothers are very intuitive and observant, but if you notice that it's only the days you take that nut, when you breastfeed, the baby start having rashes, then most likely your baby is allergic to nuts, and you should stop eating it as well. That's it. And you may notice that when you stop the rashes may disappear.
Okay, Daisy saying thank you, Dr. Gbemi. Thank you, Daisy. All right, let's keep the questions coming. We're still here. Dr. Gbemi is still here live. All right, Oladayo Debbie, she's back again. Please, doctor, is there anything like sponge allergy? Yeah. Because anytime I use sponge for just 2 days, the next day rashes will be out.
Yeah, some people's skins, some people. So most likely you have the allergic skin kind of condition. So such people, you can't use ash something on the skin. You can't scrub the skin. You just use soft clothes. You know, they have to. I think you should just say dermatologist. You have to be very soft skin. Sometimes they just use like soft
face towel.
Just to wipe their skin. You can't use sponge, and the way Nigerians use sponge, actually some of our sponge are too harsh, even for those who don't have allergies. Even those who don't have allergies. And when some of them will be scrubbing it, you think you are scrubbing the back of a pot of jollof rice.
Well, you can't blame them. You know our weather is very hot, and then the sweat and then the dust.
You don't need to do that. So just so don't do, but just go off the sponge. It's okay. Go off the sponge. Use foam, use face towel, and see whether it makes difference. And then, or it may not even be the sponging per se. It may be the substance of the sponge. Is it a rubber sponge? There are different kind of material they used to make this sponge. So it may be that particular material that was used in making that particular sponge that you are reacting to. So there are many perspectives to look at.
Dimensions.
Yeah. Okay. Sonia is already talking about granule. Yeah, we know we've answered already. So stay up granule, Sonia. Yeah, that's true. Yeah.
That's great.
Oh, Life Mask likes blood.
Life Mask, please keep your questions short, okay? My granddad used to be asthmatic, so that'll be the reason for his allergy tending towards asthma. It's really bad, and when he reacts, because he won't be able to breathe. Is he asthmatic? Will he outgrow it? Is he he's so skinny because he can't take ice cream, chocolates, cake, pizza. He can't stay in Domino pizza because of cheese.
Yes, I already suspected that your baby is having the severe allergic condition. And of course, we've already mentioned that once there's a family history of allergies, it's likely your grandfather has allergic condition, asthma. So your baby is also obviously has inherited the allergic conditions. And you may not have had it so bad, but I suspect somebody else in the family also have had it, but your baby is having it now. And your baby is having the severe kind. But I disagree with you that your baby is so skinny because he can't take chocolate.
All of those.
Excuse me, your baby don't need any of those things to grow to add weight. So please, your baby, those are not what your baby needs. There are healthy options. There are fruits. Your baby can take protein. Your baby can take egg. It's only milk now that is allergic to. I'm very told you there are other non-dairy milk. If you even go to there are even milk for babies that are like non-dairy as well, because I didn't know how old your baby is. And now, so please, that is not an excuse. Your baby should not even be eating all those junks that you just mentioned. I understand. Yes, we can give them as a treat once in a week or
Once in a
so, just a
while.
treat during the parties. But that is not what should be their everyday diet. So pizza
Ideal
or
food.
cake or chocolate, that's not their main.
Chocolate.
I mean, no, that cannot be his main diet. What happens to rice? What happens to beans? What happens to potato? What happens to butter? What
Vegetables.
happens to egg? Those are things your baby should take. And I don't know how old your baby is. You can still keep breastfeeding until baby is 2 years. And you can use non-dairy milk as well, like we've mentioned. So see your pediatrician about, or your dietitian, they work out the weights and the food, the calories your baby should take, how to go about.
One.
That's number one. Your second part of your question is about will it outgrow it? It's very difficult to answer that question now, but your baby seems to have um
Severe.
the severe kind of allergic kind of conditions. And like what I was telling you earlier, that it tends to be a match. There's what we call atopy match. So your baby is having the food allergy. It's also may likely have asthma, may likely have skin and all.
Something else.
I can't remember the other ones you mentioned before. So it is not unusual for babies to have multiple kind of allergic conditions are together. We
Allergic
call it a
reactions.
atopy match. It's like they mash together from the skin to the nose to the eyes to the uh, um, to the chest, asthma and all that. So basically, life math, you more than any other person need a pediatrician with allergy subspecialty, most likely an
Specialties.
allergist. Yeah, preferably you will get some of them in the teaching hospital. So if you go to those kind of hospital, your baby needs to be followed up routinely. And your baby is one of those baby that we really need one of what I was talking about called EpiPen. Something that, because you say your baby can't even stay in the Domino's store, that's where your baby.
Yes.
So you don't. So you really need to be ready. So in case your baby needs something like that, so you can
Yes.
quickly, if your baby reacts suddenly, you know what to do. So those are the kind of things that you need to do. Yeah.
Life maths, I hope you've heard that. Please go and
Yeah.
see your pediatrician immediately. All right, more questions. Okay, Sophia saying thank you very much. Thank you, Sophia. We appreciate you. All right. Dr. saying thank you. God bless you and your family. Amen. And you
Oh,
too.
okay. Life Math is saying he's 7 years old. Wow, you really
Oh,
need.
he's 7.
Yeah, and you must have EpiPen ready because people may not know, and it is important that
No.
you let the teachers at school know. It's important you let people know because it's a child. People are going to give him cake. People are going to give him things. You must tell him. There's one of my pediatrician's friend's son who is allergic to egg, who is allergic to fish, and all that. So each time he comes to my house, his mom has already told him he must always tell you that I don't take this. I don't,
Please
when you
don't
have a
take
child and you're
that.
trying to do birthday parties and you're trying to give them a treat, and the child, because children will be tempted, they see other children eating all this nice stuff,
Taking
and
it.
so you'll be tempted. So it's important that you let him know, and he must always tell people, I can't eat egg, I can't eat his own is milk, right? But the other one child that was talking about is about egg, and virtually all this nice thing you do, there's egg in them, so you can't eat.
And milk.
Yeah. So but your own is milk. So milk is also like a something we use often in almost all our cookings, and so it's important that you let teachers know, and people will give him things thinking they are helping him. It could react badly. So, and he must have EpiPen. Unfortunately, it's very expensive, and because it could also expire. But I just think your baby really needs to be followed by an allergist. If you're in Lagos, you can try Lassos. You have a good allergist there that will be following up your child. It's important. Yeah.
All right, thank you. Oladayo Debbie, yes, doctor. The dermatologist said I should not use sponge for her. But thanks for the idea of the towel and the foam. I will try
Okay,
that.
good. We're happy that we're able to help you.
Okay, this is from Folusho Shotomi.
I
Grace
think
Chimez.
copy for one of our from the watch party.
Oh, okay. Good morning, doctor. My son since birth is having light yellowish eye discharge. He has been taken to the hospital and was given some antibiotics and eye drop, but it has not stopped. What should I do? He's 4 weeks old.
Your baby doesn't have allergic condition. Look like your baby has what we call ophthalmic neonatal, but basically it's just eye infection. Basically, that's it. it's common in newborn babies. So if the antibiotic your doctor has given you didn't work, you need to go back. They will give you something else. They will take a culture. They will take part of that discharge, send it to the lab, because sometimes we need to. The one we are giving is not effective, and we just need to give something else. So when we do the lab test, the test will tell us which particular bacteria is causing the infection and what antibiotics the bacteria will respond to, and then we'll give your baby that. So sometimes we use most people use genticin and chloramphenicol. These are the common ones everybody can use. But some babies, their own reaction may not go with, their own eye infection may not go with those
Chemical.
eye drops. So they need to give something a little bit stronger. Sometimes we have to give some baby injections, not even just eye drops alone, injection antibiotics. Yeah, that's we do that. So that's Grace. Grace, please see your pediatrician. It's very important. It's very, very important. Yeah.
Okay. Chris. All right. This is from Folusho again. Okay. My 5-year-old boy has been diagnosed with traces of asthma and bronchial pneumonia. He has been on antibiotics, inhaler, cough syrup, and prednisone for close to 2 years. Prednisone. Please, I want to know if there is any permanent cure for asthma in children. Permanent cure for asthma, Dr. Gbemi.
Okay, number one, Nkiru, your baby doesn't have trace of asthma. Your baby has bronchial asthma. It's always important that we get things correct. If you don't get the diagnosis correct, we are going to keep on messing it up. So your baby has bronchial asthma. Let's accept that. People don't have trace of asthma. They either have asthma or they don't have asthma. Number two, then the asthma your baby has, like I was telling you quite before, it could be intermittent, once in a while kind of asthma, or it could be the chronic, or what we call persistent or asthma. And even the persistent asthma can be mild, moderate, or severe. If your baby was already put on steroids, I'm not so sure how your baby was managed. Now, if your baby has asthmatic attack, during the acute episode, we can give antibiotics, we'll give prednisolone, we will use some inhaler, and the baby will be fine. If the baby doesn't have another attack again so soon, then your baby will not be on continuous medication. But if your baby is having recurrent attacks of bronchial asthma, then your baby needs to be on inhaler, steroid inhaler, what we call preventive medication for asthma. And it's not prednisolone, it's an inhaler, but it's an inhaler something you slave in for the baby that is steroids, that contains steroid and what we call long-acting beta agonists. So those are that is the kind of medication that your baby will have to be on. So I'm not sure who is seeing your baby. I will recommend that you must also be seen by a pediatrician for follow-up regularly, because they need to. Asthma is a chronic condition. It needs to be followed up. So a pediatrician must see your baby and monitor the asthma control. If you go to our pediatrician Facebook group, if you go to our file section, you will see what you should be doing as a parent when it comes to asthma, and what your doctor should be doing and all that. It's very, very important, because parents actually manage asthma, and it's important you get it right. And asthma too can kill people if they are not properly managed. And because if the child have a life-threatening attack and you don't know what to do, it can be we don't want something like that to happen. So that is not. So your baby must be seeing a pediatrician regularly for follow-up. That is true. And whether the child will outgrow asthma or not is something that depends on many factors. So, like I said, most children will stop having asthma attacks, but some keep on having it even into it. That's why we have adult asthma. So, yeah. All right. I think our time is gone.
Fast went. Wow.
Yeah.
I was even looking at the time.
The time is flying because we have so many questions. Okay. So we need to rush now because we have some announcement to make. Okay, Life Maths, EpiPen, if you see the allergies, like I said, you need to see an allergist. It is not very easily available in Nigeria. It's very expensive, but you can always get it if you really want it. The problem with EpiPen is that it's so expensive, but you may never use it, and it will expire. Then you have to pay. Wow. So people always find that very painful. But if it is needed, it could be a difference between life and death. I'm telling you, like that boy from UK that was they even gave the child EpiPen and all that, but the child died. I mean, that's how severe some people's allergic condition are. So we'll just rush through the remaining questions so that we can round up.
Okay, King Sopara. Please, my daughter has been having consistent catarrh and headache because of always blowing her nose. She's always blowing her nose. This has been going on for months now. Also, can you suggest an allergist for us?
Yeah, your baby look like your baby has allergic rhinitis. Your baby doesn't even need an allergist. Any ENT surgeon or pediatrician can still handle that. So you can. You didn't tell me where you are, so it's difficult for me if you are in Abuja. I can't tell you somebody who is in Lagos. So it's when you ask that kind of suggestion, it's better you
Just
put
put your
your.
location.
But what general advice is the teaching hospitals always have the specialists. The teaching hospital in the closest teaching hospital to you will be the best place to get those specialists for your baby. Yeah.
Okay. Yes. My 2-year-old coughs only at night. He
Yeah.
frequently gets cold and coughs too. What could that be? What could
It
be the
looks like maybe
cause?
you also have allergy. In fact, there's some kind of asthma that's actually the way they present. They only cover at night.
Only
And
at
so
night, 1 hour.
only at night. Yes, only night coughs. So you or your baby could also have some something in the throat because you say your baby is also having cough and cold. That we call it postnasal dripping. You know, so when the child is sleeping, there's a lot of fluid trickling down the throat, and that is what is causing the cough. So basically, you just need to see a pediatrician first, and then they'll be able to figure out which one it is,
What
and then we'll be
exactly?
able to advise you based on after they've examined your baby. Because we look into the throat, we'll check whether there are other noise or tonsillitis, things like that. We also listen to the check whether there are wheezes that may suggest bronchial asthma. So people don't understand when I say something, you need to see a doctor because beyond what you've told me, when I examine your baby, there are other things that we found that will help me to know
Yeah.
which of the possible
What
options.
exactly?
So it is not always fair to ask a doctor after 1 or 2 line of symptoms, what do you think is the cause? I may have like 1,001 thing in my mind that could be the cause, but when I examine your baby, I may narrow it down to maybe another 5 or 10. Then maybe I may want to do some basic tests, and it will help me. Sometimes even after doing that, we're still not 100% sure of which one is the cause.
Sure.
Sometimes we have to just do what we call try treatment and see whether the child respond or not. Yeah, this being honest, that's how doctors work. So,
But you
but
know, mothers are not patient. We want
yeah,
to
but
know what is wrong
that's
right
why
now.
that's why sometimes people get annoyed when they go to the doctor and they tell them, you go and see the doctor. People used to attack us in the past that, but you're already a doctor and I'm already talking to you.
So tell us,
Why do you ask
yes.
me to go and see another doctor? But I can't touch your baby via Facebook. I can't touch your baby. I can't examine you. And there are still more questions I will need to even ask you that
To
if I need
ask.
to do that, I mean, I won't be able to do that online. So this is about health education, really. And when you now have questions that require that your baby should be seen physically, that is why we tell you to see a doctor. I hope that accepts somebody. Yeah.
Okay.
We are
We didn't take
wrapping
that
up.
one, Dr. Bimi. Okay.
Okay. Yeah.
Uh, the previous one.
Which previous one? Did I? Oh, I
The
didn't
one that
answer the
was no. Okay, yes. Yes, I've been giving my 10 weeks baby Piriton and Septrin for cough and catarrh. He's still coughing. The doctor said his chest is clear.
And please, okay, who is giving the Piriton and the Septrin? I hope it's not you. Because the way you said I have been giving my 10 weeks, please don't give your 10 weeks Piriton and Septrin like that. Please see a pediatrician. The baby is too young for you to be doing all that. We usually would not treat a 10 weeks old with Piriton and Septrin if the chest is clear, especially. And you didn't say the child
Mm,
has fever. So that
mm,
treatment is wrong. So a 10 weeks old baby should be on exclusive breastfeeding. If you're exclusive breastfeeding, keeping the baby warm, the baby should not be having cough and catarrh, and keep the baby away from people that have cough and catarrh because that is where they get them from. And all you need to do is keep your baby warm, breastfeed exclusively. It protects your baby from what we call acute respiratory infection. So please stop the suffering, stop the Piriton, see a pediatrician. Please see a pediatrician and do what I've said, and your baby should be fine. If your baby is not fine, please see a pediatrician because sometimes persistent cough in such a baby could be a sign of other problems.
symptom of something else.
A child with a cardiac problem, for example, though this catarrh there, that one suggests to me that it's most likely a viral infection, usually pick up from siblings or other people who come visiting, touching the baby. But if you breastfeed and you keep baby warm and avoid exposing the baby to such smoke, cooking in the house, people touching the baby, your baby should be fine. But please stop Piriton and antibiotics. Please stop. Okay, thank you.
All right. Okay. Good morning, doc. My baby is 12 months and 2 weeks. Whenever I give her semovita and iridu, I notice when she pulls the next day, the poo contains almost 90% of the iridu, like she just
Yeah,
pulled it as she ate it. Should
yeah.
I stop giving her the iridu?
No.
Please advise.
No, that's normal. There's nothing wrong. That's vegetables. So there are parts of plants or vegetables that the babies could not digest. So some,
Okay.
really in toddlers, so sometimes they don't digest, but it's good. It's fine because it helps to. They are good for the within the fiber part of it to keep the bowel moving. So it is not everything
Bubble.
that has to be absorbed into the body. Sometimes some things is also to help us with the bowel. So vegetables are good. So the way do is good. Just keep giving it. It doesn't matter. Some babies have it. With time, it will also stop as well. So, but don't worry about that at all. So don't worry about the green you will see in the stone. It's fine. It's absolutely fine. But the body is
Okay.
taking what the body needs. Don't worry about it. It's the part
Names.
that the body could not digest and absorb. That's the part that is being passed out in the stone. Yeah. All
Okay.
right.
All right. Agu, my son has has asthma, and I have tried to find out the trigger, but still comes consistently, even with the control medications given by the pediatrician. I also want to know the side effects of these allergic drugs or control drugs, the methylprednisol, and Dr. Baby, please help me out here.
Yeah, so don't
What I'm
worry.
saying.
Basically, your baby. Some I've already mentioned that before. That sometimes we don't know why some keep having the. You may not know all the triggers. That's one of
Reoccurring. Okay.
the trigger could be as simple as the change in the weather, which you have no control over. It
Control
could be
over
as
triggers.
yeah, it could be as simple as the fact that the weather is colder than the. I mean, so that's the issue. That's why. So don't worry yourself about if you can't figure the trigger. What I'm more concerned about is the control for the asthma. Unfortunately, sometimes control could be hard, especially those who are what we call the severe persistent asthma. They tend to have poorer, more difficult to control asthma. But I think you should still see your pediatrician. I hope you're seeing them, but look like you are seeing them because I can see also some drugs
The
that
list
you're
of
giving.
drugs.
We will not want to go into all the drugs and medication, but just to suffice to say that your baby, all those drugs, your doctor should be talking to you about them anyway. When they put your child on drugs, they should tell you what are the side effects and things like that. So you should discuss all that with your pediatrician because they should tell you all that. But the drugs have is supposed to help your baby. So we will not put your child on any medication that's the good must outweigh the bad for us to put the
The
child
bad.
on medication. Yeah.
Okay. Sonia, my son of 6 years has had some rashes coming out of his armpits. It's not like the normal heat rash. Could that be he's reacting to something? And his sister has a very dry skin. I don't know the cause.
Okay. We also can't say what it is until we say it. So it's better it's a possibility because you say your children have dry skin and you've asked us some question about allergic condition. You were the one asking about
Yes.
the eyes condition.
Yes.
I think most likely your babies have atopy match. So there's one for the eyes, one for the skin, and all that they are all going together. It's possible, but it's better to see the pediatrician first so you will know what it is. We're just trying to take all the questions that already come in already so that we can round up. I
Okay.
know our time is up. Just give us another five, ten
Okay.
minutes and then we'll round up. Yeah.
Okay. This is from John. We have allergies in the family. And as I started having kids, I discovered they got it too. Now my second baby has what we told the doctors as atopic dermatitis. But
Dermatitis.
the cream, okay. Well, the
Yeah.
creams we were giving worked for a few days, and I'm not seeing any improvement anymore.
Yeah.
Even so, another dermatologist, and it's still the same. Is there any other
Yeah.
remedy for this?
Yeah, I understand. You see, the parents need to understand, John. There are some conditions that we can only manage. We can cure them, and atopic dermatitis is one of those. It's a condition that tends to worsen and wane. It comes and goes. So we deal with each time it comes. So I know sometimes when parents use those creams, it helps, but you think it will cure it. It's not going to cure it. Is going to make
Hmm.
it will help,
Better for that.
but it will come back again until the children
Okay.
agree. The same thing just with like asthma. So even with all your preventing medication, the children can still have attacks, even despite the fact
Attacks.
that they are on those prevent. So the medications are not meant to be curative. They are not meant to take it away completely. They are just meant to kind of suppress it, if you
Manage
like,
it.
and try to make it easier or better. But sometimes it just doesn't go away completely. So don't be impatient with your dermatologist. I really feel for the dermatologist because most times they are dealing with this problem. They have used this, have used that, it doesn't work, what do I do? What do I do? It could be very frustrating, but you just have to be patient. You just have to take it as part of that child's life. That's part of their skin, that's part of how they're going to grow. So, but with time, it could get better. But just don't be it's so hard to say this, but don't think there's any magic wand anywhere. It's very hard anywhere in the world, and that's absolutely honest truth. It's a condition that comes and go, and with time you can only get better. You can try your best, avoid allergens, use the cream, do those things, but it takes time. It will keep going and coming until finally you're out of it. Yeah.
All right. Okay. This is from Alison Lawal. My baby has rashes around her mouth and below her eyes as well. Could the rashes be allergy?
Honestly, we can't answer that question without seeing the rashes and without asking more questions. So there are many causes of rashes. Infection can cause rashes. Allergies can cause rashes. Rashes can even be normal. So there are many things. So we can't say whether it's allergy or not without seeing your child. So it depends on how the rashes look like, whether there's something triggering it off and all that. That's what we can help us to know, answer that question. So it's difficult to say. So, but I'll just see a doctor first and they will advise. Yeah. Okay.
Biology. How do you know when children have allergies?
Okay, isn't it you are just coming? So what I
Oh,
advise
yes.
after this one, watch it all over again, and I'll answer your question. So there are symptoms you will see: the rashes, the wheezing, the watering of the eyes, and other. When they are exposed to certain things, then you know that most likely those children are having allergic reaction to the person. Yeah.
Okay. Okay. Agu, can golden more cause allergies?
Any food can cause any food that a child can react to can cause allergy. Most children have what is in the product you mentioned is still a cereal. So if a child can react to it, can react to anything. Yeah. Okay, I think we're almost getting to the end.
Okay. This is from Adibe. My 4-year-old baby always scratches her body and there is no rashes. And
Yeah.
anytime I start giving my kids milk after exclusive, they do have rashes. They most
Yeah.
likely have allergies.
So yeah, most likely it's still allergic reaction. There could be
Yeah.
palm allergies, and you don't have to have rashes in allergy. The itching itself is still one of the allergic symptoms. So you don't necessarily have the itching is actually even more what normally starts first before the rashes. And
Before the
if you
rashes
give
comes
your
off.
baby milk, what kind of milk do you give them after exclusive breastfeeding? When you are doing exclusive breastfeeding, after exclusive breastfeeding, you should keep on breastfeeding while you are giving other food. So you don't necessarily have to give other milk. You can keep giving breast milk as well, up to 2 years, and you can give other milk. If your baby reacts to a particular milk, try another milk as well. So that's it.
Okay. This is from Chika. What medication do I give my 5-year-old for catarrh with wound in the nostrils?
Okay, Chika, we don't prescribe medications online. It's not ethical thing to do. We need to know what is wrong with your child first. And please don't just go and buy any medication when your children have something. Your child has a wound, has a catarrh. You should see a doctor first. Let them examine the child, know what is causing it, and then they can give you the appropriate medication. And we don't usually prescribe medication in our group, except simple first aid medication like paracetamol, and which anybody can use. But we don't prescribe any other kind of medication. Thank you.
All right. Chineye, her baby is 6. Since birth, if she's breathing, we'll be hearing a sound as if her breathing,
Mm,
and at times her breath, she breathes from her mouth.
yeah.
Though it has reduced on like when she was very young. Please, what can be the cause?
Okay, I'm sure you
Now
know that.
she's 6.
Okay, so this is a typical symptom of a child with adenoids enlargement. So your history is so typical. But I'm happy that you said that it's better now, because usually when
No,
they're about 5 to 6, it tends to shrink on its own.
yes,
And if it is shrinking on its own, then there's no need for surgery. But
nothing
some
to
children have it,
worry.
yeah. Some children have it so bad, we really need to do surgery and take it out. So if it's no longer causing a problem anymore, don't worry. But if you still worry or the child is having frequent infections, tonsillitis and all that, then you may see your ENT surgeon, because after 6 years, the chances that it will grow smaller is very low, and they may just have
Yeah.
to take it out. But if it is already better, then you just relax and maybe it's okay. It's most likely an
Understood.
adenoid enlargement, hypertrophy. Yeah.
Okay. We've taken this question, Dr. Bimi.
Okay. All right. Okay.
Yes.
Sorry. I think you got it twice.
Oh, okay.
Yeah, I think that's our
Okay, this
last
is from
question.
Judith. All right. Judith, I want to ask if there is any ways to give my 7 months old son food he still likes, breast milk or other foods. And each time I give him cereal, he pulls immediately. Please help a first time mom.
Hi, Judith. Welcome. So it is okay for your baby to still like breast milk. We want you to keep breastfeeding until 2 years. Yes, but you
Well,
need to gradually introduce new food and don't be impatient. Your baby is just 7 months, so which means you just started a month ago to introduce new food. So there's nothing wrong
yeah,
with the baby also going after giving food, as long as it's not
okay.
watery too. That is fine. That is just normal reflex of the body. So when something enters into your stomach, it stimulates some reflex that goes down to the large intestine, and then the baby passes. So even some adults still do it. So there's nothing wrong with that. As long as the stools are normal, that does not mean your baby is allergic to the syrup. And that does not mean there's anything wrong. As long as the stools
Yeah.
are normal stools, they are not watery and all that. So I don't think you should worry yourself at all. But for how to go about the complementary feeding, you need to go to Ask the Pediatrician Facebook group. Now, when you go to the group, look in the menu section, look for what we call units. When you get to units, go to Nutrition 102 and you will see the learning units on complementary feeding. We have very beautiful videos that will take you through what to give, how to give it,
How
how
to
frequently
give.
to give it, what to avoid. You also do that course, you become a professional when it comes to complementary feeding. So I don't think you need to worry at all. Okay, so we're done. We're done. We're done. Okay, seems to have disappeared, but I'm sure she'll come back. So thank you for joining us. We're sorry we take an extra so much of your time today. And now I'm just going to talk to us about that this program you've been watching has been brought to you courtesy of Ask the Pediatricians Foundation. We are a group about child. We are after the welfare of children. And one of the things we do beyond what we do online on asking your question on our Facebook group, or doing this ACP Live Health Education Program and our group discussion in our Facebook group, we also go beyond the Facebook group. We go offline to the communities that really, where we have indigent children. We try to reach them in our community medical outreaches. And we have been doing this for the past 3 years, and we usually do two major outreaches every year. We do our May outreach during the Children's Day, and for those of you who are aware, this year we're in Ekpe on May 27th, Children's Day. We celebrated with children of Ekpe, and we also do outreaches during our Independence Day, because we're a Nigerian based, we are registered fully in Nigeria, though we reach to all the parts of the world. But in terms of our community outreaches, we do it mostly in Nigeria. And for the first time, we are going to go beyond just one community. We are doing 5 communities at a go. And so we want you to know that next week, Saturday, there will be we will have ACP live, but I will not be asking questions or taking a particular topic. You'll be watching us live from our outreaches that we're going to have in 5 parts of country. So we're going to be in Kwara, and Kwara outreach is okay. Welcome back. But I'm talking
Thank
about
you, Dr.
our
Bimi.
ATP life. And so, I'm talking about our Ask Pediatrician Foundation outreach. And that is why you say that myself and Okwe, we are wearing our ATP t-shirts today, just to tell you that what we do on ATP. And so we want you to know about our next week, Saturday. We're actually doing it between Saturday to like Monday, which is the October
Okay.
1st, which is the 58th anniversary, 58th
58,
independence
yes.
anniversary of
Wow.
Nigeria. So we are celebrating the Independence Day by doing community medical outreaches. So we'll be in Kwara, and so that's we'll be in Kwara at Oru, and that's where we'll be reaching about 1,000 children in Kwara. We're also going to be in Abuja, and
Yeah.
that's very big for us, because that's actually capital of Nigeria, and we're going
City.
to be in
Yeah.
Nyanya. Yes, so we're going to reach
Yeah,
over
yeah.
500, estimated 500 children in Nyanya as well. And when we do our medical outreaches, what do we normally do? Okay, I think you can tell them what does in our outreaches. Having been in all the
Okay.
you've been in all
All
our
the,
outreaches. Yeah. Wow, that
yes, yes.
even more than me. Okay, so
Okay,
we
okay.
yeah, go on, okay.
Okay, basically what we do is we reach out to children,
Yeah.
as many children as we can have, as many children as we have planned
And what are
for.
the features we reach them with?
Yes. Okay. The first thing is they get to see a doctor. We do okay. The first process, we register them to get
Yeah.
their data, so that we can know what to do with them. Then they go to the nurses. We check their vitals. Everybody gets the wand. It's very
Yeah. That's
important.
the
Most parents
worry of all
forget
the
this.
children.
Yes. Yes, you get the wand, so we check their vitals, and then everyone gets to see a dentist. They get scaling and polishing. Even
Yeah.
some mothers have not done that in years. Their
Yeah.
children will
For
get
free.
that
Everything for
for
free.
free. Yes,
Yeah.
you see a dentist, and then afterwards you see pediatricians. If you really are very ill, we take those ones over every other one. Those that are very ill, but every child gets to see a doctor or a pediatrician, and then you get your drugs for free. We
Yeah.
do tests, yes, at the outreaches,
We do
yes,
our
we do
malaria
tests,
test, HIV test,
and
hepatitis
all
test.
of that. And it's
And
not just that. We have some free gifts for you. Loads of goodies.
yeah.
Loads of goodies to
Yeah, so
go
all
with
the
it.
children get a healthy lunch. We give them, because we
Yes.
want to demonstrate to them about
What they
healthy
should
nutrition.
do.
So they get a full healthy lunch complete from
Pack.
Active Nutrition, and they get
They
water,
should.
they get drinks, and sometimes apart from that, but
Fruits. Sometimes
we
fruits.
give them fruits. So we also give them clothes. So we have clothes because
Yes.
usually we reach to indigent community, so we give free clothes and things like that. Sometimes we give gifts, things. And
Yes.
this time around, we also do entertainment for the children. So it's not a boring
Yes.
event. So when you are kids,
Time
it's
out.
always a carnival. We enjoy, the children enjoy it. We give them books. We also do health talks. We talk to the children, talk to the parents how to make sure that their children are healthy. And beyond that, this time around, we have inside attraction. Because one of our supporters, which is the Frisnap campaigner, Pick 456, they are going to be in all the locations, and they are going to give the children their product. The Pick 456
Yes.
and Pick Choco is going to be wonderful, and they're
They
going to
get
do
smoothies.
yeah, they're going to do face paint
Healthy
for all the
smoothies.
children. There's going to be smoothies and takeaways and all that. So it's going to be wonderful. So really, so we're celebrating our active pediatricians Independence Day through 5 outreaches in Abuja, in Kwara, in Abeokuta.
Wow.
Abeokuta is going to be
Elkuta.
placed in a Centenary Hall opposite the Alakis Palace. We're hoping to reach
Nice.
about 500 children in Abeokuta. And of course, in Abia, in fact, we are the hosts, and we are being hosted by the Speaker Hope Foundation in Abia, and with the
Yeah.
support of the First Lady of Abia State. So it's going to be wonderful in Abia. Uh,
Okay.
and Abia is going to be October 1st, and we're going to reach
Yes.
about 500 children in Abia. And of course, our base.
Korodu.
So this time around, we've been to Lekki, we've been to, no, we
Yes.
started with Makoko, then we went to
Makoko, yes.
then we went
Ijigun,
Jakonde
Lekki,
Lekki, then we went to Ekpe,
Ekpe,
and this time around, by popular demand of the Ikorodu,
Live
we are coming to Ikorodu. So a lot of
and
people,
direct.
if you want to know ACP people, come out and watch. We're going to be in somewhere around Igono, but I can't remember the
Igbo
address.
Igbono.
Yeah, so it's going to be wonderful. So this is what we're going to be doing. And so if you have been blessed by ATP, you've been part of what, oh, sorry, okay, I think I should take that down now. So if you've been part of what we're doing and you really would love to be a supporter of Active Pediatrician Foundation, you can still support us. We have 7 days. This time next
To
week, our
go.
outreach will be ongoing in Lagos and I think Kwara, and then Abuja, and then on October 1st will be Abia Abel puts on October 1st. That's a public holiday. So it's going to be wonderful. And you can be part of it. So if you want to be part of it, there are many ways you can be part of it. So just make sure you reach out to us. If you, I'll try and see if we can show you our account details so that you can donate. If you want to donate, we'll be very happy for you to donate to us. So every amount received is accounted for, and we use it solely for the purpose of the outreach. We don't. Yes. Okay. I think I have something to show now. Okay. So this is our Ask the Pediatrician account details. If you're a corporate body and you like to sponsor either this outreach, or you want to also feature your own products, you are welcome to be part of it. Or if you want to donate to us, the account details is showing on your screen. Or if you want to sponsor even our ATP Life, you are really, really, really welcome to be part of it. So it's going to be wonderful, and we really appreciate you joining, being part of these outreaches, and we touch many more Nigerian children. And as we round up, the final announcement to tell us that after this broadcast, if you drop your questions, we will not be able to answer it. So please don't drop your questions on this video. If you want to ask questions, whether on allergic conditions or allergies or even other topic on child health, that is what we do on Ask the Pediatricians. Just go to our Facebook group. Our Facebook group is, if you just type in Ask the Pediatricians into Facebook, it will take you straight to our page. We have our group, we have our page, but the group you will see is about 500,000 people. Then you know that you are in the right Ask the Pediatrician Facebook group. Click join, we will approve your membership. Then you post your questions to us. All questions are subject to admin approval, but we approve your question. We work Mondays to Saturdays. Please, we don't work on Sundays. Sundays are our rest day. Please, try to send us questions on Sunday. People always say we can't get through. Please, we don't answer questions on Sunday. But from Monday to Saturday, 24/7, you can post your questions. It will be approved. Our moderators, we have professionals, they will answer your questions. Depending, if it's something a moderator can handle, it will be handled faster. If it's something a professional needs to handle, you may need to exercise a little bit of patience, maybe between 48 to 7. But we try to answer most of our questions within 48 to 72 hours. And then well, of course, we do health education and information. And if you also want to read, you can also read a lot of things on this page. So you can always ask the pediatrician your questions, but please drop the questions in our group. If it's something anonymous, you don't want your name to show, then you have to email us. Send your email to ask@askthepediatricians.com. If you go on our group, there's so many questions that have been answered already. You can use the search button, and you don't even need us to answer, because you just get the answer by yourself. We also have the learning units. We have the file section. We also have our YouTube channel. If you want to watch all our previous ATP Live videos, all the previous ATP Live videos, they are available on our page. They are available on our website, www.askthepediatricians.com. They are available on our YouTube channel, youtube.com/askthepediatricians. So you can get all this health information. So many ways by which we can assist you, because our goal is to promote child health intelligence, and that's what we do on ATP. And we're so grateful for you for joining us this morning. So thank you so much. Okay, what do you have to say? We have to go now.
Yes, I have to go. But one thing I have to say is I've been at all the outreach, and putting smiles on the faces of these children means a lot. So please donate to ATP and help put a smile on one child's face at least. Thank you for being a part of ATP Live today. Thank you very much, Dr. Gbemi. I have learned a lot as well, and I'm sure you have learned something.
And thank you for everyone. Thank you for being part.
Yes, thank you all. Thank you.
Bye.
Have a nice Saturday.
Bye.